And we've got 5, 4, 3, 2, 1. Good afternoon. It is Tuesday, June 18th. This is Public Health and Safety. We do have a quorum with myself, Council Members Benton, Bradford, Huffman, Nash, Sepulveda, and Weiner. And then I'll pick up anybody else that comes in along the way. I do have a consent agenda. We do not have anyone signed up for public comment. So just to give everyone a heads up about that. The consent agenda I will go ahead and read off the item numbers, and then I'll see who wants to pull anything off of consent. First item on my proposed consent agenda is item number 3, RS 2024-526. Then I have item number 4, RS 2024-527. Item number 5, RS 2024-530. Number 6, RS 2024-531. Item number 7, RS 2024-532. Item number 8, 9, and 10. So we've got RS 2024-533, 534, 535. And then I skip over to item number 12, RS 2024-540. Item number 13, RS 2024-541. Item number 14, RS 2024-542. Item number 16, RS 2024-544. And that is it. Is there anything on my proposed consent agenda that anyone would like to pull off? Okay, I'll go ahead and read everything. And then if there's something that strikes anyone's fancy, I will recognize people again. So let's go to item number 3, RS 2024-526, Porterfield Evans and others, approves the sole source contract between the Metropolitan Action Commission and UTJ Holdco Incorporated, DBA Teaching Strategies LLC, for the provision of research-based birth through kindergarten educational assessment software. Item number 4, RS 2024-527 by Porterfield Evans and others, approves a grant from the Tennessee Housing Development Agency to the Metropolitan Action Commission to be used for emergency rental assistance in accordance with the purposes set forth in Section 3201 of the American Rescue Plan Act of 2021 to provide financial assistance and housing stability services to eligible tenants. Item number 5, RS 2024-530, Porterfield Evans and others, approves a contract between the Metropolitan Board of Health and American Public University to provide clinical and non-clinical experience opportunities for its students. Item number 6, RS 2024-531 by Porterfield Evans and others, approves a contract between the Metropolitan Board of Health and the University of Tennessee to provide clinical experience opportunities for its students. Item number 7, RS 2024-532, Porterfield Evans and others, approves Amendment 9 to a grant from the U.S. Environmental Protection Agency, or EPA, to the Metropolitan Board of Health for the ongoing collection of data on ambient air concentrations for fine particulate matter in Nashville, Tennessee. Item number 8, RS 2024-533, Porterfield Evans and others, approves Amendments 1 and 2 to a grant from the Centers for Disease Control and Prevention, or CDC, to the Metropolitan Board of Health to implement foundational capabilities to build organizational resilience, promote employee well-being, and enhance workforce performance while focusing on healthier communities. Item number 9, RS 2024-534 by Porterfield and Evans, approves Amendments 2 and 3 to a strengthening public health infrastructure, workforce, and data systems grant from the Centers for Disease Control and Prevention to the Metropolitan Board of Health to implement workforce strategies to build organizational resilience, promote employee well-being, and enhance workforce performance while focusing on building healthier communities. Item number 10, RS 2024-535 by Porterfield and Evans, approves Amendment 5 to a Community Health Workers for Public Health Response and Resilient grant from the Centers for Disease Control and Prevention to the Metropolitan Board of Health to address COVID-19 health disparities in the Nashville area. Item number 12, RS 2024-540, Porterfield and Evans, accepts the terms of a cooperative purchasing master agreement for training management software for the Nashville Fire Department. Item number 13, RS 2024-541, accepts an emergency management performance grant from EMPG from the Tennessee Emergency Management Agency to the Office of Emergency Management to subsidize the emergency management program. Item number 14, RS 2024-542 by Porterfield and Evans, approves an application for a port security grant from the U.S. Department of Homeland Security to the Office of Emergency Management to improve the detection, deterrence, prevention, and response to hazards in the Port of Nashville. Item number 16, RS 2024-544, Porterfield, Evans, and others, approves an application for a DNA capacity enhancement for backlog reduction, CEBR program grant from the U.S. Department of Justice to the Nashville Police Department Forensic Biology Unit to outsource sexual assault kits to private vendors for forensic case sample analysis to reduce the backlog associated with DNA analysis. That is the conclusion of my proposed consent agenda. Does anybody have anything they'd like to take off of consent? Looks like we have Council Member Benton. You're recognized.
Thank you, Chair. And this just be for something very brief, just number 10, 535.
Number 10, okay. I will go ahead and we'll pull that off. Anybody else have anything? Okay, do I have a motion? All right, it's been moved. Do I have a second? All right, second, thank you. It's been moved and properly seconded. All those in favor? Anyone opposed? Anyone not voting? Okay, thank you. We recommend approval. 8 in favor, 0 against, 0 not voting. Let me go back and actually we'll skip over and go ahead and pick up item number 10, and then I'll come back. RS 2024-535, this is approves Amendment 5 to Community Health Workers for Public Health Response and Resilient Grant from the Centers for Disease Control and Prevention to the Metropolitan Board of Health to address COVID-19 health disparities in the Nashville area. Do I have a motion? Okay, it's been moved and seconded. Do we have discussion? Councilmember Benton, you're recognized.
Thank you, Chair. So it's my understanding that, and I think you've answered this before. No, come on back. It's directly related to COVID-19, and I think this is part of what the ARP funding. And so I'm just clarifying that what I think I heard last time still really applies here. And I think this is not super restrictive about a specific thing like this. It might be used for other problems, even the flu, or is it even opioids?
Council, Mr. Sharp, you're recognized.
Tom Sharp from the Health Department. It's a fair question because the nomenclature for the name of the grant is fairly old, and it does sound a little odd at this point. That grant has morphed over time into basically a community health worker grant, which is something that we have been wanting to get out into the community for years, and we managed to do that with this money. I think what this does is convert them to contractors is all it does. They're doing the same kind of work. They help people navigate the world that have difficulty with the system. The impetus for it, the genesis of it was during COVID, there were clearly areas that were more badly affected by the disease than others, which is not too surprising. And so we tried to put additional resources into those areas of the community. And that has grown into this program to try to help those areas better connect with access to care primarily.
Councilmember Benton.
I'm good. Thank you.
Okay, thank you very much. Thank you, Mr. Sharp. Okay, we'll go back. First of all, do I have a motion? All right, it's been moved and seconded. All those in favor of item number 10? Anyone opposed? Anyone not voting? Okay, thank you. So we recommend approval, 8 in favor, 0 against. Oh, 9, thank you. That's right, thank you. Thank you for helping me count. All right, we're gonna go back up to item number 1. This is RS 2024-483, Porterfield, Bradford, and Evans. This adopts a new pay plan for employees of the Metropolitan Departments of Police and Fire effective July 1st, 2024. Do we have a motion? Okay, it's been moved and seconded. Do we have discussion? We have some amendments. Councilmember Porterfield, amendment number 1. Do you intend on moving that amendment? Okay, hang on, let me recognize you. There you go, you are recognized.
Thank you, Chair. This amendment amends the pay plan to get to a 4% COLA.
Okay. Any discussion on this amendment? Okay, do we have a motion on this amendment? Okay, it's been moved and seconded. All those in favor of Amendment 1, please say aye. Anyone opposed? Anyone not voting? All right, it's been recommended approval. 9 in favor, 0 against, 0 not voting. Let's go to amendment number 2 by Councilmember Welsh. Councilmember, do you intend on moving this amendment? Okay, hold on just a second and let me do, first of all, can I get somebody from the committee to move this amendment? Do we have a motion on amendment number 2? Okay, we do not have a motion on amendment number 2. So let's move on then to amendment number 3. Councilmember Welsh, are you interested in moving this amendment? Do we have a recommendation from the committee to move this amendment? Okay, I do not see a recommendation to move forward, so then we are going back to amendment number 1. Amendment number 1 has passed, and so now we are voting on RS 2024-483 as amended. All those in favor of item number 1 as amended? Anyone opposed? Anyone not voting? Okay, thank you. So we recommend approval, 9 in favor, 0 against, 0 not voting. Next, we'll go on to RS 2024-484, Porterfield, Bradford, and Evans adopts a new pay plan for employees of the Metropolitan Board of Health effective July 1st, 2024. Do we have a motion? All right, it's been moved and properly seconded. We do have an amendment from Councilmember Porterfield. Councilmember Porterfield, you're recognized.
Thank you, Chair. This amendment raises the COLA from 3.5% to 4% COLA, and I will ask for your support.
All right, so that has been moved. Any discussion on this amendment? Seeing no discussion, all those in favor of amendment number 1? Anyone opposed? Anyone not voting? Okay. So then that is recommended approval, 10 in favor, 0 against, 0 not voting. We'll go to amendment number 2 by Councilmember Welsh. Councilmember, do you intend on wanting to try to move this amendment? Okay, Councilmember Welsh would like to move this amendment. Anybody on the committee interested in moving this amendment? I do not see anybody interested in moving this amendment. How about amendment number 3? Councilmember Welsh, I assume you want to move that one. Thank you. Anybody in the committee who would like to move this amendment? Amendment number 3. Okay, seeing nobody who wants to move the amendment, it will not be moving forward. So we have RS 2024-484 that has been amended with amendment number 1. Do we have a motion on RS 2024-484 as amended? Okay, it's been moved and seconded. All those in favor? Anyone opposed? Anyone not voting? Okay, we recommend approval, 10 in favor, 0 against, 0 not voting. Okay, so we're going to move on to item number 9. Actually, did I should have had that as consent, did I? Okay, perfect. I did it correctly. Okay, so we're going to move on to item number 11. RS 2024-536, Porterfield, Evans, and others appropriates a total of $464,000 from the Office of Homeless Services to the Salvation Army for the provision of housing services to people experiencing homelessness in Nashville. Do we have a motion? All right, it's been moved and properly seconded. Any discussion on this item? I have a couple of questions, and so if the Office of Homeless Services could come to the podium. Thank you, Mr. Clendenning. Could you identify yourself for everybody?
Good afternoon. Bill Clendenning, Grants Coordinator for the Office of Homeless Services.
Thank you, Mr. Clendenning. I was looking over, I know we had discussion about this last night, but do you have any information that you're able to share with the public really related to the Salvation Army and some of the provisions that are in the agreement, like related to, we had like connection to housing within a certain amount of time and things of that nature, and like how many people will they continue to support as part of this grant? And then also, like, where do we stand with moving the folks, the residents involved forward in the process?
Yes, sorry. I did also bring the council report, so that has some of that information in there.
Okay.
So I just wanted to reference that. There are 2 capacity agreements for the Salvation Army. One is funded by OHS, one is funded by ARP. And this one was to supplement the larger one, the $1.9 million one that was funded by ARP, but we had to add some language to that and revise the agreement. So it got sent back to Salvation Army Corporate, which takes several weeks. But it is in the pipeline now, and it has been signed, so it should be at the next council agenda.
Okay, so then we'll have like a follow-up piece of legislation basically that also references the Salvation Army? Is that my
Correct.
understanding? Okay.
Yes, and this was mainly to provide a rental subsidy for the next few months while that was going through the process.
I see. Okay. Well, then that's perfect. And then I'm going to hold probably some of my other questions since we'll have that additional piece of legislation. And that way we can kind of talk about it a little bit more holistically related to, some of the things that I wanted to bring up. So thank you for providing that clarification. And we'll come back to you at the end related to the Office of Homeless Services. So I appreciate you answering my question.
Of course, thank you.
Yeah. Does anybody else have any questions for Mr. Clendenning on this piece of legislation? Okay, seeing none, do I have a motion? Okay, it's been moved and seconded. All those in favor? Anyone opposed? Anyone not voting? Okay, we recommend approval. Okay, we're going to move on to item number 15. This is RS 2024-543 by Porterfield and Evans. This approves amendment number 1 to contract number 6488663 between the Metropolitan Government and Axon Enterprise Incorporated. Do we have a motion? Okay, it's been moved and properly seconded. Any discussion? Councilmember Huffman, you're recognized.
Thank you, Chair. Just a few questions, and I think it'd be appropriate for Deputy Chief Gilder if he's in the back.
And he is.
He was ready for me. Thank you. Couple of questions. We'll start with the overall sound. I really want to put an emphasis on this as I was able to experience the difference of the T7 and the T10 by taking a trip over to the police academy a few weeks ago. So my question for Deputy Chief Gilder is, could you just walk through for my colleagues, excuse me, that may not be as familiar or been able to have the experience that I did regarding the sound that the T7 makes versus the T10?
Sure. So kind of two things. One is the T7 makes a pretty loud pop when it is deployed, when the probes go out. The T10 is a much quieter deployment. I think that's a good thing because there has been concern around the country. We haven't had an issue here, but of folks who misperceive the pop as possibly a gunfire when in fact it's a taser deployment. So I think the quieter report on the T10 is definitely an advantage. I'm assuming that's what you were referring to.
Thank you. And Chair, if it's okay, I've got just three more. I'll
Yes.
try to rapid fire. Could you talk also regarding the range of the two and how that plays into the safety of the officer and the suspect?
Sure. So the range on the T7 is 25 feet max. And keep in mind that even though you're at 25 feet, you're aiming for 2 points on the body at the same time, and you have to hit both of those points on the body, which is often moving around in a confrontation. And so that's a pretty difficult, a tall order. The T10 range takes you from 25 feet out to 45 feet, and you actually have 10 chances to deploy the probes, and you individually target those probes so that if somebody's wearing something heavy clothing wise, or you have a better target area, it's 1 point of aim at a time. You're not having to divide your attention and try to aim at 2 places at once.
Yeah, and I'm glad that you mentioned the ease of use there, because one thing that I really would also like to discuss is when you pull the taser out of the holster from the 7 to the 10, what I noticed is on the 7, it took I don't know if recalibration is the right word, but essentially you had to kind of flip it before the lasers would align back. Could you just compare that between the 7 and the 10?
Sure. The Taser 7 has a close range set of darts and a far range set of darts. And so if you're further out, you need to switch. You have to adjust it, and it adjusts the sighting mechanism so that the probe spread, obviously, the further away you are, the more the probes are going to spread. So those little aiming dots adjust for the distance. The Taser 10, the dot comes on, and where the dot lands is where the probe should land. So it's right on already.
And last question around the audit capabilities. So from from my understanding, the T10, you're able to tell every time that it's taken out of the holster, correct, in an uneditable audit. Is that correct?
That is correct. It audits that. So anytime the taser is deployed, we actually, as part of our requirements for our force policy, we require anytime that taser is deployed at someone, they have to report it. Even if for some reason something didn't get reported, it's on the audit log, and those are reviewed. And so they would go back and sync that up, look at body worn cameras, see what occurred. So you can't to pull a taser out and the department not know about it. It's captured on the device.
And how does that compare to the audit capabilities of the T7?
So the T7 does have audit capabilities, but the 10 is increased. So it's the detection on the removal from the holster is stronger as opposed to like activating the taser on the 7. It'll pick that up. It can tell if you turned it on. So there are audit capabilities on the 7, but they've increased those capabilities for the T10.
Thank you.
Thank you, Councilmember Huffman. Anyone else have any questions on this item? Councilmember Porterfield, you're recognized.
Thank you so much, Chair. My first question is, I think there's been a little bit of confusion about what this does and doesn't do. So can we get an explanation from Deputy Chief Gilder on what this does and what it doesn't do? And also what's different than what this body already voted down just a few months ago?
Yeah, Deputy Chief Gilder.
Sure. How the device works, you mean? When you say what it does or doesn't do?
Absolutely not. With this legislation, what does this legislation do and what this legislation doesn't do?
Oh, okay. I'm sorry.
No worries.
So the legislation is an amendment which allows us to purchase, instead of Taser 7s, which is what we currently carry, it would allow us to transition into utilizing Taser 10 devices. It is a contract that allows for us to purchase those. It is not allocating funding to the department. It's just a contract that allows us to purchase up to the value of the amendment over the course of the next 5 years.
Councilmember Porterfield.
Thank you so very much. Can you tell us what's different than what we voted down a few months ago?
So the device is the same. This is the Taser 10, which is the same device that was considered last fall, November into December. The terms of the agreement were changed. Before it was a 5-year and a 5-year, so effectively it was a 10-year deal, given the concerns around the length of the deal, the price tag, and then, whether devices may change over that 10-year course. We went back and said, okay, well, let's look at a 5-year deal to address some of those concerns. So that's what this is a 5-year amendment.
Thank you, Deputy Chief. And then can we also talk a little bit about, and Chair, if you don't want to entertain this, I understand because this is going into finances, but this contract more than doubles the amount of the current contract. So if we can get a understanding of why this contract is doubling the cost of, more than doubling the cost of the current contract.
So this contract, the contract that we're under currently for Taser 7s, there is a price point difference of per user price, which is, it's $93 basically per user on the Taser 10, and it's around 70, 71, 72. The number's not right in front of me for the Taser 7. But part of what the price increase is the increase in the number of users. The current contract that we're under only allots 1,400 users. Our authorized strength is 1,658. We're well over the 1,400 officers. So we're actually having to borrow tasers from Taser in order to ensure that all our officers carry one. So you're increasing the number of users by 258. That's a big driver on the cost.
Councilmember.
Thank you. And can we also have someone explain why this is a high-risk contract? I asked that yesterday, and I didn't get an answer.
Yes, Councilmember, or former Councilmember Rosenberg.
Thank you, Chair. Thank you, Council Member. So high-risk contracts, any contract that has a contract value of at least $10 million, has a term of over 5 years, or involves service to vulnerable populations, including the homeless, children, or elderly, are called high risk. What the moniker actually means is that additional oversight is given during the procurement process, and that departments must also monitor the vendors closely for performance objectives, and may also be subject to additional monitoring by the Office of Financial Accountability.
Councilmember Porterfield.
Thank you, former Councilmember Rosenberg. Do we know why the previous contract proposal that came to us a few months ago that we overwhelmingly voted down was not high risk, but this one is?
Or
I do not.
Mr. Rosenberg.
Thank you. I think that that will be really important for us to know before we entertain this. Also, concerns about just wanting to make sure that we have time to really properly vet this. And I appreciate the administration for bringing this as a late filed during our last meeting when we were in the process of our budget hearing and wanted to hear from our constituents. And this meeting, we're passing the most important piece of legislation of our council term. And I personally would love more time to dig deep into this contract to make a determination on if I could support this or not. Would also love to understand why this contract is high risk as opposed to the one that we overwhelmingly voted down a few months ago that was not high risk. So I really would like to have a good understanding of that. So with that, Chair, I would like to move for a one-meeting deferral, and I would love if my colleagues support it.
Okay, we have a motion for a one-meeting deferral. Do we have a second? Okay, it's been moved and seconded. Any discussion on a one-meeting deferral? We've got Councilmember Weiner. Hang on just a second, I can't find you. Oh, here. Councilmember Weiner, you're recognized.
That's because I'm short. I would like to ask Mr. Gilder if, Assistant Chief Gilder, I'll spit it out. Can you share with us if there is a one-meeting deferral, what impact that would have on where we are today with this, please?
Sure. So what we would like, we wanted to get we brought this last fall, November, December, obviously a different financial structure deal. But, we've been trying to address concerns about the device. During that time, I fielded lots of questions. We've had folks come out and actually, like Councilmember Huffman, and look at the device. But bottom line is Chief Drake feels very strongly about the safety, the increased public safety that this device brings. And it's just, superior technology. And so delaying it any further, we have concerns about. There is money that we are going to apply this fiscal year to the TASER contract. And our hope was that that money would be applied to this amendment as opposed to the TASER 7 contract. Because again, we've got to have the increased number of users. That's the other thing, is we don't our current contract does not provide for enough users. So we have to have more tasers, irrespective of whether they're 7s or 10s. And so that's why we would really like to pass this as soon as possible.
Councilmember Weiner.
I have one more question.
Sure.
Just as a refresher, because it's been since the fall, can you please share with us the benefit to an officer and to the public, as well as whoever they're dealing with in an altercation where you would either pull a gun or pull a taser, and what the benefit is versus the not a benefit between having one and not having one?
Sure. So the taser is a de-escalation tool that oftentimes when we confront someone with, if there is an officer there with, if it's in the case of a firearm, we'll have officers there with lethal coverage, but there also can be, if there's an officer there with a taser, then they're in the position to be able to use that taser, then they may be able to take that person safely into custody without having to utilize a firearm. It's also highly effective in edged weapons where, we can't get close to someone because that's a deadly weapon. And oftentimes, if without a taser, the only other option is to utilize deadly force. So tasers are a game changer with the ability to de-escalate encounters and reduce the need for deadly force. I haven't done the studies, but I don't know of any major departments that don't carry a taser device because they are such an effective de-escalation tool.
Thank you so much.
Okay.
I am going to speak against a deferral simply because at the end of the day, we have heard an overwhelming outcry for de-escalation opportunities with the interactions that our officers have. This is safer for the public, it is safer for the victims, it is safer for the officers, it is safer for the person with whom they're interacting. And for those reasons, I think to move on and get it done. Thank you.
Thank you, Councilmember Weiner. Let me go to Councilmember Nash.
Thank you, Chairman. Council Lady Porterfield has done such a wonderful job on the budget. I hate to be in disagreement with her on this issue, but I would speak against the deferral. We've had lots of time to get questions answered on this item. And the big concern, as I remember last time, was, well, it looks like the police department every 2 years got to have a new toy. Well, and we found out that, in fact, we had a long 8-year contract on our first taser. Then the 7s came along. They were no longer supporting the old ones. So we bought into the 7, and then, within this 2 years, yes, a very superior weapon came in, or taser came into being, that is safer, more effective. As far as at-risk contract goes, I suspect, by the definition we were given by the administration, I suspect the last one was also an at-risk because of the length of the contract and like. And I think that's kind of inside baseball that I don't know would warrant a deferral.
Thank you, Councilmember Nash. Anybody else who would like to speak on the deferral? Councilmember Porterfield, you're recognized.
Thank you, Chair, and I appreciate those kind words on the work on the budget, Councilmember Nash. The last contract, I actually have them both pulled up, and the last contract does specifically say it was not a high-risk contract. And this one does specifically say that it was a high-risk contract. And that question was proposed yesterday in committee, and it was not able to be answered, nor was it able to be answered. The impacts of a deferral, or else we could have taken this up in our Budget and Finance Committee. Another question regarding the deferral to Deputy Chief Gilder. If there is a deferral, does the department lose this money? Because it sounds like to me that the department could still spend it. It would just be spending it possibly on the 7s. So is there a deferral? If we get a deferral, does the department lose their money?
Well, we don't lose the money. We would just be spending it on the device that we're trying to transition away from. So it doesn't make a lot of sense, I think, for us, if we know we're going to transition to a 10, to not go ahead and apply that to the amended contract. But that's what we're prepared to do if it gets approved.
Thank you. And then you mentioned you all needing the loan, using loaner tasers. So ideally, the new contract would allow you to get more tasers, but currently y'all are borrowing tasers from Axon. So currently, all of our officers have tasers. Is that correct?
Currently, we do because, again, we've had to borrow them, and they've been on loan through this whole process. So, but yeah, we're having to borrow them.
Thank you. I appreciate it. So, colleagues, I understand you vote however you feel so led to vote, but I'm going to reaffirm my position of asking for a one meeting deferral so that we can get some more questions answered and to be able to dig deeper into this contract. I think this is a big deal. If we're making such a big purchase like this, we just want to make sure that we get it right. So I would love if my colleagues support a one meeting deferral. Thank you.
Thank you, Councilmember. Councilmember Bradford, you're recognized.
Thank you, Chair. A question for Deputy Chief Gilder. Is there a higher associated cost with when we borrow equipment?
They've not, to my understanding is that they've not charged us an additional cost because they know that we're pursuing a contract for additional devices. And to try and help us out and carry us over until that could be done, they were providing the additional handles until such time as we could get the contract passed. But again, we're going on 6 months, 7 months now.
Okay. I'm going to be speaking against the deferral because what we've heard is they're going to be spending money on devices that are going to be replaced within a couple of years or even a couple of months with the new contract. To me, that's wasteful spending. I was not sent here by my constituents to waste their taxpayer dollars. So if there's a way we can go ahead and use what money we already have allocated, go ahead and do the upgrades to the new system, I'm in support of that. So I will be voting against deferral.
Thank you, Councilmember Bradford. Councilmember Benton.
Thank you, Chair. I just remember not long ago hearing all the arguments on all sides of this Taser 10 versus the previous. And I was thoroughly convinced already at that time that the superior product would be the one we would hopefully get. And I think if we were buying them today, we would be getting 10s. And I do believe in, or that is a superior product. And I would love for them to be able to have that and have a chance to use non-lethal force against somebody. It was your child or, your family member that, may be taking a bad path. At least maybe they wouldn't have to pull out that service revolver or service weapon.
Are you speaking against the deferral?
I'm speaking against the deferral.
Okay, thank you. How about anyone else on the deferral motion? Okay, let's vote on the deferral motion. All those in favor of a one-meeting deferral, please say aye. Aye. Okay, so we've got 2. All those opposed to a one-meeting deferral? All right. Anyone not voting? Okay, we recommend disapproval of the one-meeting deferral. So we'll go back to the legislation. Do we have any more discussion on the legislation? Do we have a motion on the legislation? All right, it's been moved and seconded. All those in favor? Anyone opposed? You're also against? Okay, so we've got 2 against, the remainder's in favor, and so we recommend passage. Okay, now we have a late resolution. This is a late filed resolution by Evans, a resolution approving Amendment 1 to a grant from the Tennessee Department of Mental Health and Substance Abuse Services to the Metropolitan Government, acting by and through the Davidson County General Sessions Court for the provision of the Tennessee Certified Recovery Court Program to incorporate intensive judicial supervision, treatment services, sanctions, and incentives to address the needs of nonviolent offenders with substance use and/or co-occurring disorders. Do we have a motion? All right, it's been moved and seconded. Could I get someone, I don't know if the administration wants to speak to this or if there's somebody from the General Sessions Court who is here to speak to it. Okay, please approach the podium. And if you could introduce yourself and just give us a summary of what this legislation does and why it's late filed and those kinds of things.
Sure. Hi, my name is Allison Tarpley. I'm the program manager for the Davidson County General Sessions Recovery Court. So this amendment provides some extra salaries, benefits, and fringes for employees, and it also provides additional training for our team members. There would be one training that would provide opioid overdose prevention training for 2 staff members that we can then provide to all of the participants in our program, and another training for burnout, compassion fatigue, vicarious trauma for all of our team members. We're asking that it be, we've late filed because we didn't receive the amended contract until June 7th. So we worked last week to try to get all the documentation in place. The funding must be used within the fiscal year. So we have until June 30th. I've lined up the trainings to be conducted within, the next 12 days or so. But if we don't, if it's not passed tonight, we just lose the funding.
Okay. Thank you so much. How about any discussion on this item? All right, seeing no discussion, all those in favor of this late item? Anyone opposed? Anyone not voting? Thank you. You recommend approval. Okay, then the last item on our agenda is BL 2024-390 by Huffman, Bradford, and others. Amends Section 2.63.020 of the Metropolitan Code of Laws to require the Office of Homeless Services to maintain an inventory of homeless service providers throughout Davidson County. Do we have a motion? Okay, it's been moved and seconded. Any discussion? I'll recognize the sponsor for a summary.
Yep. Thank you, Chair. Appreciate the time. Essentially, what this legislation does is it attempts to get some organization around our fight against homelessness here in Davidson County. This is a battle that I am intimately close with, not only in my community, but also with serving on the Homeless Planning Council as well. One thing that I have found is we've got a lot of great organizations that are providing a lot of great services to this community. What we don't have is a way to tell who's doing what, where they're doing it, and when they're doing it. Essentially, what this legislation would do is it would require a service provider to register with the Office of Homeless Services on an annual basis. It would require them to list the services that they provide. And what this is going to do is it's going to help us fill in any gaps that we may have within certain communities. You know, I have a growing homeless population in my district. And regardless if these people can vote for me or not, they are still my constituents and they still deserve basic dignity and services. This helps us take that step. And I ask for your approval. The last thing that I will mention, we're 13 days away from the 1-year anniversary of the Office of Homeless Services. This is still a young department. We are still building this out, and this is going to be an important step with that. And with that, I'll move for approval. Thank you.
Okay, thank you. And I saw Councilmember Porterfield. I recognize you.
Thank you, Chair. I have a question either to the department, I guess this will be to the department. Would it be required to have, would this legislation require specific encampment names
Mr. Clendenning or Director Calvin?
or locations?
Good evening. Director Calvin of the Office of Homeless Services. We will not list locations or locations of encampments or even locations or of council districts because that should be private information.
Okay, thank you. And then will this be used to prevent organizations from providing resources in any way?
No, ma'am. This will be to help coordinate best practices, national best practices, even harm reduction efforts. I think it's important that we continue to follow. I expressed to our team earlier today 2 things that I think that it will help with. One is educating the community on harm reduction efforts and other ways to help save lives and to fight for housing. And then second, to strengthen our collaboration with the community partners.
Okay. Perfect. Thank you so much. Because I received some messages from individuals that work in this space, and there were just some concerns about Facebook messages, that things that were put on social media that constituents believe that this will be, I'm sorry, I should be addressing you, Chair.
No, you're fine.
Constituents believe that this will be used to stop organizations from providing resources. So individuals who don't want unhoused people to get resources, they believe that this will be a way that they can stop people from getting like propane or tents or things of that nature because they feel as though it's littering their community. So I just want to make sure that this is in no way going to stop our unhoused neighbors from getting the vital resources that they need.
Yes, Director Calvin.
That is not a plan of ours. I think that we look at housing-focused resources and ensuring that people are getting, outreach is about helping to maintain and sustain life. And then the housing-focused efforts would be housing opportunities and entered into coordinated entry and other housing opportunities. I received the same text messages and concerns as well. I'm not a part of that Facebook group, so I had no idea that some of that conversation was going back and forth.
Thank you. I appreciate it.
I have one question actually for you, Director. So I guess one thing as I was reading everything related to service providers, like I know we've got pockets of Davidson County where there really aren't any service providers kind of working in different communities. And then kind of thinking about that, like I know always that if I see somebody in need and I connect them to our outreach worker through you, Lakeisha Davenport, that I know that she will assess their situation. She will work with them to get them into, coordinated entry and HMIS, and kind of as she builds those relationships. And so I guess you still have, because it's been a little while since I've been on HPC, do you still have providers that are not entering data or don't have access to be able to enter data whenever they're engaging, with people experiencing homelessness?
That is correct, Chair. We are working diligently with our homeless management information system to get more people actively involved. I believe we've increased the number of providers. I had some numbers earlier today, but I can't think right now. And I can share that with the team, with the council here on the number of providers that we've increased by. I think it's important to note that we will utilize this piece of legislation to help strengthen that so that we'll know. Our outreach team, we host weekly large group and small group outreach meetings. And those are conversations that we've been having for probably the last 2 years on having a coordinated effort and understanding who's providing services where. I think some places are completely saturated with resources. And as you know, there's some places that don't receive enough resources.
Thank you, Director Knight. I'll come back to you, Councilmember Huffman. I saw Councilmember Nash next.
Thank you, Chairman. So I know we've had the homeless management system where we've been trying to get caretakers registered and people that are homeless listed so we kind of have some idea of who's providing what services. And previously, it has been very siloed, and I understand the need for that kind of software. Is this to get people entered into that system, or are we devising another system?
No, sir. We will utilize the same homeless management information system to get more people enrolled. And also, I think we're up to about 45 agencies that actually utilize that system, which is a huge increase since I've been on. And we have some other incentive opportunities. We're going to incentivize agencies by offering workshops and other connections with Day 7 so that will incentivize them to be able to utilize this. Another huge incentive is that our office does not charge licenses to those agencies. They get to utilize this for free. Some agencies actually use this as their only database, so we're getting a lot of new increased data, which is exciting.
And I guess for the sponsor, that's kind of your intent to get more people into that system? Thank you very much.
Thank you. Councilmember Huffman.
Yep, just to wrap it up, I've seen the Facebook posts that have been mentioned, and this is not meant as a dig at all, so Councilmember Porterfield, please, I hope you don't take it that, but I would refer to the legislation itself and not social media. Thank you.
Okay, thank you, Councilmember Huffman. Any other discussion on this item? Councilmember Porterfield, you're recognized.
Thank you, Chair, and thank you for that clarification, Councilmember Huffman. Definitely did not take that as a dig, but did also want to make sure that we got it on the record, the intent and the impact of the legislation, so that the people that are doing this work will be clear on what their limitations could be, because that would, depend on how we vote, if that's going to limit resources. So definitely didn't take it as a dig, and I appreciate that. Thank you.
Thank you, Councilmember. Any other discussion on this item? All those in favor, first of all, let's renew the motion. All those in favor? Anyone opposed? Anyone not voting? Okay, you recommend approval. Okay, with that, we're finished with our legislative agenda. I did want to recognize Office of Homeless Services. Mr. Clendenning, we don't have that much time, but if there's any high points that you want to hit on your information with us, that would be great. Otherwise, we also can get it by email if you would prefer, or people can take it with them. It's up to you. You probably have about 5 minutes.
Thank you, Madam Chair. I think I can hit some highlights and we'll send you the report as well.
Okay, sounds great.
We continue to work with the service providers, the supportive service providers, which I think is really important because they're serving clients at a very high level, especially the case management, MinMe, the step up on second. And we think that it's hugely important, but the monitoring has given us insight into each of the agencies in their program and allowed us to work with them to increase their efficiency. But it also allows us to, help them with any challenges or opportunities. And we're taking that to heart. And I think it's starting to really I can't think of the word, but come together. So we're excited about that. I did want to say that there's still a challenge around capacity, and I think Councilman Huffman's ordinance speaks to that. We recognize that, and we're trying to empower the community the best way we can. We provided a lot of trainings recently. We brought in some national speakers again with similar type cities and situations. But we are also fostering partnerships with national leaders, the National Alliance to End Homelessness, and Albert Townsend, who is our Director of Lived Experience and Innovation. We're in partnership with him, and he is working with our Consumer Advisory Board. And that's really gaining traction because we know that that is at the root of these efforts and the success that will come from it. But also Dr. Samson Barris, we are still working with him. He was the founder of the Housing First concept, and he was also just recognized as one of Time Magazine's 100 most influential people of 2024. So that Housing First movement is really important as a Housing First city. There is other information, but of course we'll get that sent to you.
Okay, thank you so much. I really appreciate that. And is there any department that's represented this evening that has anything that they need to update the committee on? I am not seeing anybody rush to the podium. So I will say that there are two things that I guess I wanted to bring to folks' attention. We will potentially hear July 2nd from Dr. Ann Melville Chester. I'm basically extending an opportunity through Mr. Sharp for her to come to the committee and speak to us about opioid settlement. Originally, I think throughout this entire process, we were under the impression that the opioid settlement, the contractual language and legislation would have to come before the council in order to be approved. I have learned that that is incorrect. It will not be coming to the council. And so we will hear from Dr. Melville Chester potentially in July. And so, Mr. Sharp, it looks like you've got something to say. You're running.
Yes, ma'am. Did you talk to her? Do you know that she will be here the 2nd?
I have not.
Okay.
And so this is just like my public, hey, we're going to see if she can come. If she can't, we'll find another
And
date.
yes, I hope so, because I really want you guys to have a chance to hear from her.
Yeah.
I will check and see if the 2nd works and let you
And if
know
it
as soon as I
doesn't, we'll
can.
just figure out an alternative
Yes,
date.
ma'am. Thank
Yeah, thank you, Mr. Sharp. And then July the 16th, our second meeting in July, I do have confirmed for sure Dr. Maury Nation from Vanderbilt University, who is his research area focus is on community safety, in particular youth violence and prevention, and he works a lot with MNPS. And so he'll be coming in light of the legislation that we're passing tonight on the budget to talk a little bit more about, things that he's doing in the community, but also to kind of set some clarity around actions that are already taking place, for instance, at MNPS. And so we'll hear more from him. And then I've got other things to share, but I'm just going to hold because I tell you, I got more than 4 minutes worth of other things to talk about, and I'm just going to save them for the July 2nd meeting or X. It depends on what I decide to want to share on first. But I appreciate everybody's time, and with that, we're adjourned.